Welcome back once again. As we earlier said, a very important, very promising national initiative and project known as the Beginning for Human Being. It's a national project for human development, like I earlier said in the intro, upon the directives of His Excellency the Head of State, President Abdel Fattah al-Sisi. It's a national project generally for human development, but targeting human beings or the citizens, Egyptian citizens, from the age of birth and until 65 years old, which is the first of its kind, not only focusing on youth, but for humanity at large, for all age brackets in society. Like I said, it's a national project, and it is going to be executing or achieving the goals of the Vision 2030, the government's program for sustainable development, providing opportunities in health, education, job opportunities, culture, sports, you name it, on all facets of life. And of course, those activities is targeting all age groups and supported and empowered by the government to shed more light over this empowering and inspiring project, national project by the government. We are very delighted to be having with us live over the phone Dr. Islam Anan. He's a professor of economics and epidemiology. Good morning, Dr. Anan.
Good morning. It is my delight.
It's a real pleasure to have you this morning.
Thank you. Pleasure is all mine.
Thank you so much, Doctor. What exactly is the definition now, as we are witnessing one of the greatest and most empowering and inspiring national projects for human development? How do you define the healthcare within the framework of the new republic?
That's a very good question to start with. So if we are defining healthcare in the new republic, it does not represent only curing illnesses. It represents a paradigm shift from that. It's not about treating illness, as I was saying, but fostering a very comprehensive ecosystem where we can actually view health as a fundamental right and as an enabler for dignity, productivity, and equity. By that, not just we are just putting jargons or terms. It means we are moving from what's called a system centricity to patient centricity, and now by the vision of 2030 you were just mentioning, we are moving towards a person-centric care. The person-centric care, which is mentioned in the SDGs of Egypt and in Vision 2030, and mentioned by President Sisi many times, is actually about not treating people with diseases, but to prevent the diseases from happening. Thus, focusing on the health itself as a product. How can we prevent diseases from happening? And hence, you can see a lot of programs where prevention and early detection are actually the target. For example, when you see the newborn screening, we are actually screening every single newborn admitted to the newborn ICU, for example, for 3 years now. And this is because we need to early detect any genetic disorder. Another thing is the premarital screening and counseling presidential initiative, again aiming to decrease any genetic diseases that may actually come from the marriage of the relative conjunctivitis. And as well, if we look at all the presidential initiatives, we have 14, most of them are either prevention or about early detection. So under this vision, the healthcare integrates this preventive and curative rehabilitation services to tailor to each citizen. We are going towards what we are calling precision personalized medicine, where we can as well, that's a second goal, customize treatment and personalize healthcare towards each individual on his own. And this is a new trend since the early 2010s, which is happening around the world. And 5 years from now, we will be witnessing a lot of personalized healthcare where actually treatment is per person and not just a prescription taken for everyone. This will take a lot of public health awareness. It will take a lot of technology, and hence something like technology transfer is one of our main objectives currently. That's if we can define simply what will be the definition of the new healthcare in the new republic.
Well, relying to this new definition of healthcare, my second question to you is, can really healthcare be linked and can contribute to human development programs, different human development national programs, and also can it be able to, the healthcare file in its own right, could it be able to achieve the sustainable development goals in some ways?
Okay, and they are strongly linked. Health is actually the engine of human development. It influences education, as you know, productivity. So a healthy nation is a productive nation. And in health economics, and currently in Egypt, we calculate for each illness how many absent days it will actually have if we are not treating. And this is one of the main key performance indicators to select a medication, for example. And again, if we're talking about health as an engine of human development, it's as well a long-term socioeconomic stability KPI, key performance indicator. Citizens were healthy, they will actually be more productive. Children will attend the school consistently. Youth can develop skills, join workforce, and of course, if we're talking about the productive age, they contribute meaningfully to the gross domestic product and the economy. And for example, just to shed light about this one, if we're talking about diabetes, if we are not managing diabetes, we will be burdening the economy and the nation by 24 billion Egyptian pounds every year. If we are managing complications, we can reduce this figure into half. So treating diseases is linked to human development and linked to actually productivity big time. And preventing non-communicable diseases, as the diabetes I was saying, through early screening, lifestyle interventions, and putting a lot of effort in early detection. If we can actually spend $1 in the prevention, we are gaining to the economy around $3 to $4 in terms of gain. So they are truly linked. And it will affect as well the lifestyle. If we are saying in the previous answer that our main aim is actually health, not just treatment. It's about happiness, it's about welfare, it's about feeling better with a better quality of life, we need to make sure that we are achieving the sustainable development through two things, health and education. If you look at the SDGs 3, the Sustainable Development Goals 3, it's good health and well-being. And this is in the core of our actually belief in healthcare, how to achieve SDGs 3. Healthcare is actually linked to this SDGs 3 and actually linked to the SDG 1, which is no poverty. If you link both, how can we achieve both? Poverty is linked by education and health. So if we are promoting health, you are treating as well poverty. If you are making sure you have access and good reach to all rural areas and to socioeconomic classes where they don't have access to enough or sufficient healthcare units and services, we are making sure we are decreasing poverty as well. If you look at SDG 8, for example, decent work and economic growth, it will be linked as well. In short, every pound we are investing in health, it leads to exponential return, whether in human capital in terms of poverty, economics, and in decent work and economic growth.
Right. Building on that, how have the comprehensive healthcare insurance system contributed to achieving social justice, which is one of the main pillars of the Sustainable Development Goals?
So the main idea about the universal health coverage, the new one, is first to make sure we are splitting the paying system from the service providing, and that's actually was done already by the law in 2018. And currently we do have two separate authorities, and the main aim of the authorities is actually to make insurance for all. Currently, we do have 6 million Egyptians as a pilot under the universal health coverage. And if you look at the 6 million citizens, Egyptians, are actually benefiting from that. they are paying premiums as an insurance system, and if they cannot afford to pay the insurance premium, the government will be paying on their behalf or subsidize the payment itself. However, at the end, we are talking about a comprehensive management where, for example, instead of queues where they go to the primary healthcare unit in the old system trying to get a consultation time, they can just book their appointment by phone. We are talking about a referral system, a strong referral system from primary care to secondary care, linking that to the waiting list initiative as well if they need surgery or they need a tertiary intervention. So it's one of the most powerful tools for social equity. It eliminates the financial barrier, as I was saying, and the financial barrier was actually preventing millions from seeking care or paying out of pocket. We would like to decrease the out-of-pocket expenditure in healthcare from being 65%, which is this year 65%, which is a high number, to reach a 20% only by 2032. So the universal health insurance system, it will guarantee this basic package of services for each citizen to make them not paying out of their pockets, regardless of their income, age, or geographic location, when it will actually go from governorate to governorate. As I was saying, it's 6 million currently, and the main aim by 2032 is to reach 110 million citizens.
Right. So how does the citizen health impact on the quality of production, education, social stability, and I mean, in all, does it going to affect the rate of economic development in any nation?
Yes, it's a very good question. A healthy population is a productive one. Workers with chronic illnesses are more likely to miss work. There is a high absenteeism. They will be less productive. As I was saying, from diabetes alone, we are losing productivity of 3 billion Egyptian pounds every year because of diabetes. Because of cancer, we are losing another 1.5 billion only from absenteeism and premature mortality. So it's quite linked between both of them. In contrast, healthier individuals will contribute to economic growth, supporting the families, for example, because if we're not only talking about productive age illnesses, but we are talking about children where I need a caregiver, their parents, guardians will be actually taking care of them. We're talking about senior citizens where also we do have caregivers sitting with them. And if they are healthy, they will be working, paying taxes. In education, students will be better in terms of health outcomes, especially in early childhood. They will perform better academically. Society stability also hangs on mental and physical health, and we are talking about mental health in specific. This is a very important one because it's indirectly linked to everything. And we do have a high level of stress worldwide currently. Being in a very fast-paced digital and a blue screen world, we are facing a lot of challenges. We do have a high percentage of depression, medical depression, not just mood swings. We do have a lot of stress-related diseases. If we can treat the root cause of all these diseases, it will be mainly stress. So if we can achieve the mental and physical health stability, communities will have good access to good health services. They will be more resilient and less likely to experience the unrest and economic dependency. So we'll be more economic dependent, and we do have an autonomy in terms of between the education, health, and the gross domestic product in terms of economy.
How can raising awareness, could be having a role on prevention as an essential part of healthcare, and how could it be enhanced?
So, preventive measures in general is not easy in terms of awareness. If you are inviting people to do screening or checkup, and they are not feeling any symptoms, it's very hard for them to go to a healthcare unit and make a checkup. It's a normal human thing. For example, we never go to a dentist unless we are in severe pain, all of us. So awareness in terms of prevention is not an easy job. But if you look at, for example, the 100 million healthy lives initiative, 100 million صحة, and you look at the hepatitis C campaign, we ask ourselves a very important question. How could us invite 50 million Egyptians to do a screening and they don't feel any symptoms? This is awareness, and this is actually one of the most successful campaigns worldwide, and hence we got the award from the WHO, the gold tier, because we convinced people to go from their places, their homes, head to healthcare unit and do a screening for hepatitis C. Of course, we need an incentive. Every country is doing that. So we incentivize them, not by money, but we incentivize them by flyers, education, sessions, doing all the labs and actually doing hypertension, pressure, non-communicable diseases test for free. That was actually encouraging. Plus, the personal invitation. We didn't depend on the digital one. So prevention saves lives and money. We all know that. But it requires cultural change. We need the integrated efforts at school, for example. So if we look at another presidential initiative, which is stunting, anemia, and obesity presidential initiative, where we screen 10 million school-age children every year. So again, awareness was the main drive, whether from the Ministry of Education and the Ministry of Health in collaboration, how to convince parents it will be in the favor of their children to make sure they are not facing short stature stunting, for example. They are not facing any level of obesity, and if so, how can we manage and we tackle the health problem so they will be more healthier? Of course, it's an integrative and collaborative thing. The Ministry of Health alone will not going to be able to do it for all citizens. We need all the societal entities like the NGOs, non-governmental organizations. We need PACs, patient association groups. We need our ministries, as I was saying, Ministry of Education, for example. All of us, and of course media, and what we are actually doing is a very important point. We're raising awareness through media. It's very important for people to know that I need to make regular checks to prevent diseases or to early detect diseases, because it will be much, much, much better if I'm actually discovering in a late stage, which can have consequences that can sometimes be fatal, unfortunately.
Right. Talking about 100 million lives, I mean, we all love to talk about 100 million lives and cherish together the successes that resulted from this national campaign, health campaign, over the years. But then, can we consider 100 million lives as a health campaign, a successful health campaign, one of the main pillars for the success of the economic vision for 2030? I mean, is there a strong relation between both?
So we can look at numbers, for example. We are talking about a campaign reached around 150 million visits from Egyptians. Not 150 million Egyptians, of course, we are 110, but 150 visits. So it means people are actually going. So this is a first key performance indicator, one of the success pillars. Another one, actually, how the campaign is actually designed is truly a success, because the 14 presidential initiatives are linking from newborn, which is from newborn screening, till senior citizen management. We do have newborn screening. Then at school age, we do have the stunting, obesity, and anemia. Then we do have for youth the non-communicable diseases, and we do have the mental health presidential initiative, the hepatitis C presidential initiative, till we reach the senior citizen management. And we have the waiting list as well, presidential initiative, for people who are actually trying to have a tertiary intervention, where we do have a turnaround time of around 2 months for operations and surgeries. So another pillar for success. If we are talking money in terms of economy, every pound we are spending in 100 million health, because we spent billions in the campaigns, but there is a huge and a big return on investment. For example, in hepatitis C, every pound we spent was returned to the economy 3.75 pounds. So we are talking an ROI of around 437%. If we are talking about non-communicable, the $1 will actually be returning as a $3 to $4 in terms of prevention. If we are talking about women health, the presidential initiative on women health and early detection of breast cancer, every pound returned as a pound and a half in average. So if we are talking health, it achieved the KPIs of health. If we are talking economy, it achieved the return on investment and a positive economy in investment and impact.
Right. On that note, of course, Dr. Islam Anan, you are a professor of pharmacoeconomics and epidemiology. Would like to thank you, sir, very much talking to us on the Breakfast Show, and you have a good day. We're going to go to a short break and we'll come to continue the show, so stay with us.